All right. Hello, everyone. Welcome to the 2024 Title V Funding Proposal Request for Applications. This is our second year of posting this possible award. Let's take you through the changes. Number one, my name is Kelly Bells. I am the Women and Infant Health Program Manager here within the Maternal and Child Health Unit at the Wyoming Department of Health. My program specifically has two priority areas in Wyoming, the Women and Maternal Health priority area and the Infant Health priority area. So we're looking to fund projects that tackle improving the health outcomes or even lowering the maternal or infant mortality for these two priority areas. Our current program is working on increasing the percentage of women in Wyoming who receive a preventative annual visit, increasing the use of safe sleep priorities, and increasing the environmental rules, including putting your kid on their back, making sure they're sleeping in their own space. And then reducing tobacco use among women of reproductive age and women who are pregnant or postpartum. And I will let my coordinator introduce herself.
Hi, my name is Natalie Hudnick. I'm the Women and Infant Health Program Coordinator.
So Natalie is going to be the one that is probably going to be communicating with you if you have any questions about our process. If you are trying to work through maybe some of your ideas, Natalie is the one that you're going to be talking with. Okay, so what is the 2024 Title V Funding Proposal Request for Applications? Please ignore that it says 2023. We're definitely
the slides posted on the application page will be updated to reflect
they'll be updated. And you may see some other little things like this, but we're definitely not going to pause and re-record. So we're just going to keep on rolling. So what is this application? So this is our second year of doing this award. Last year, we were very grateful to get many applications. We ended up funding 3 different projects. If you are curious to see what those projects were, please go to our funding page. We are very happy to explain a little bit about what we've funded in the past, but please keep in mind your project does not have to be exactly like those projects. So we're seeking applications from community-based organizations for programs and services that are in alignment with the following priorities. We're looking to improve well women preventative service access. We're looking to improve infant safe sleep practices and the environments that they're in. And then we're interested in reducing the tobacco use during pregnancy and postpartum. So there's a lot of creative ways that someone could tackle any of these 3 issues, and we're very interested in funding any of those ideas. And if you aren't sure if maybe your project idea hits any of these 3, again, please reach out to us. Feel free to talk to us. We're very happy to answer any questions you have. We already have a FAQ up, frequently asked questions on our website, so please check it out. The application process. Very simple process. Our applications are opening January 2024, which is probably when most of you are going to be watching this video. It closes March 31st, 2024 by 6 p.m. Mountain Time. To apply, you can just fill out the Google form application. Now, if you are with an agency or organization that does not allow you to use Google Forms, that's completely fine. We also have a fillable PDF that you can fill out. There is no preference or basis, whichever you choose. So don't feel like if you can't get access to the Google form that we're going to score you lower. It really doesn't matter. Use whichever one works for you. Once your application is submitted, you'll be notified by email whether your application has been chosen to move on to the next round of review. You will be notified by the end of the first week of April. If chosen for the next round of review, you must prepare a presentation on your program or initiative, and you'll be presenting to us the week of April 15 to April 19, 2024. You're not going to have to make this from scratch. We're going to be providing you some slides, so don't feel like you have to make nothing into something. We'll definitely provide you that stuff. And then once all presentations have been reviewed, you'll be notified by email if you've been chosen to receive funding, and then we'll work with you throughout the contract process. If you've never contracted with the state before, That's fine. We're definitely here to support new organizations that maybe haven't gotten a grant or a subaward before. So now we're going to take you through the application to just maybe answer some questions that aren't obvious. If your question is not answered during this, please check out our frequently asked questions. And then if it still isn't answered, please feel free to email us. We are very quick to answer, and we'll update our frequently asked questions based off your question. So let's get into it. So this is what you're probably going to see if you go into the Google form. Again, if you cannot access the Google form, that's fine. We'll send you the fillable PDF, but just know they're going to look a little different, but the questions will be the same. So you're going to put in your email, and then next slide. And then you're going to fill out your name, your organization, your address, your phone, your email address, and your unique entity identifier. Now, if you're a new organization who hasn't contracted with anyone else before and you don't have a subaward and you've never gotten an award from the state, you might be unfamiliar with what a UEI is. So a UEI is the number that the SAMS registry system creates for you when you're part of the SAMS registry. Now, the state cannot give funding and cannot have contracts with organizations that do not have a UEI number. We're going to pull up the website for the SAMS registry to show you what it looks like. And there's going to be a link both in the fillable form and on the Google form. So this is SAM.gov. SAM is a system that all federal and state entities use to track organizations to make sure that they have all of the insurances they're supposed to have, the documentations they're supposed to have, that they've been paying their taxes, all of those good things that show that you are an upstanding organization and or business. This website is free. I want to be very clear to everyone that you should not be paying anyone to get on this website. It's just a way for the federal or state agencies to track you're doing everything you're supposed to be doing as a business or an organization. It is not supposed to cost you any money, but the process can be a little tedious and it can take a little time. So we really recommend that you start the process. If you are not currently already an organization that's within SAM.gov, we recommend that you start the process months in advance. So if you are still kind of figuring out what your project is going to be, if you aren't 100% sure, we would recommend that you start the process now, and it will give you a UEI number. And you can use that UEI number in your application. And hopefully by the time we get around to doing the contracting, you're already approved and fully inputted into the system. So just know you're more than welcome to start the process, get your number, and then complete the process once we've gotten to the contract period around March. So that should still give you enough time to get everything done. If you have any questions about this process, you're more than welcome to email us. But it is pretty straightforward. It just does ask a lot of documentation from you. So that's how you're going to get your UEI number. And then the name and title of the authorized signature. So we do want to say that most likely the primary contact information person may be your CEO. It may be someone else within your organization that has that authorization for signature. And then next slide. It's more than likely possible that you're going to be that secondary contact person, and that's fine. But we really do recommend that you have two contact people on here. Let's say you just put your CEO. We're going to be emailing them dates and times to interview. We're going to be emailing them clarifying questions. So it is really important that whoever you put as your primary and secondary is somebody that can actually reach you because we are going to be emailing them. And when we email people, we're going to be emailing the primary and the secondary contact. And it's definitely fine if you all have the same UEI number. That's very normal. We would anticipate that most people are going to have the same UEI number because they're from the same organization, and your UEI number is not individual based. It's based off your organization or business. All right, so let's get into the questions. So we're going to ask that you give us the name of your program or initiative. It's fine if you haven't come up with something. We can help you with that later, but just give us a gist of what the program initiative is. So you can put safe sleep to be determined. That's fine. We just want to get an idea of what your program or initiative is and what the name may end up being. We want you to provide one sentence description of your program or initiative. Programs or initiatives cannot be a one-time event. So if you are looking for funding for, let's say, a community baby shower, this would not be the opportunity for you. We are definitely looking to fund an organization that's going to be putting in an initiative or a program in their community that's going to go for some time. It may be 6 months to a year, and you are going to be tracking things from that. We're really looking for programs or initiatives where we're able to track outcomes. So that's really what we're looking for. So one-time events aren't really something we're looking to fund at this time. We want you to be able to provide 2 short-term SMART objectives your program or initiative will achieve. If you are looking for information on how to make objectives, if you've never done this before, we have a link there that should help you figure out how to create a short-term SMART objective. So keep in mind when you're making a short-term SMART objective, let's say that your overall outcome is to reduce the number of kids that die of suffocation in your community. That would be a long-term objective, something that's going to be a little harder to track in a short amount of time. Maybe instead of tracking it for a year, not very possible. That's something you're going to have to track over the next couple of years. So even though that might be your long-term goal, we're really looking for the SMART-term goal. So let's say you're doing a safe sleep initiative like we just talked about. So how many people did you end up giving education to? Could be something that you're measuring. How many people did you give out books to? How many people did you give out cribs to? That kind of thing would be more in line with a short-term SMART objective, except that you would also be saying by what time did you want to give out so many cribs? Who would be in charge of doing that? If you need to talk through, maybe your project or initiative is a little more advanced than that, feel free to email us. We're definitely happy to kind of talk through what your objectives could be depending on what you want your project to be. We just always recommend to people, think to yourself, what is your goal? What are you actually trying to improve in your community? And then work backwards. So you're like, oh, right, well, I want to improve the amount of women that actually go to their annual visit. And I want to do that through our local library. You know, how can we do that? And just start working backwards. And that's kind of one of the easier ways that you can come up with your project idea. So is the proposed program or initiative new and not yet started, or current and existing? I want to be really clear that it does not matter to us if you're trying to bolster an already working program. That's completely fine as well. Or let's say that you currently are doing a program that is losing funding. That's also fine. This does not have to be a brand new project or initiative. We're very happy to fund and strengthen local projects that are already going. Outside of funding, please note any support you may require from the Wyoming Department of Health to complete your proposed program or initiative. We're very aware that the organizations that may be applying for this opportunity may not have had technical assistance before. They may not know how to budget. They may not know how to do outreach. We're here to help you, and if those are needs that you think that you're going to have during this project, please let us know ahead of time, because then we can try to budget for it and figure it out after you've been awarded. What is the estimated cost per year of your proposed program or initiative? We do want to say that currently we're only funding organizations for 1 year. So give us your idea of what you want for 1 year. And if your project is something that maybe is really working, or maybe you want to expand on it, that's definitely something that you can reapply for next year. So we have this application going every year. It's a rolling application. If you would like to extend your program for another year, we can do that. But right now, we're only interested in how much this initiative is going to cost for the 1 year. We do get from people, they're curious, how much will we fund? We will say we do not like to go over 50,000, but we also are very cognizant of the fact that if you have a large impact, let's say the difference between funding a county and funding the whole state is going to be a lot different. So if you ask for 50,000 and you're just funding one program within one county, then we're going to really, it's going to have to be really impressive. So keep that in mind. But generally, if you're funding just one county, we're maybe looking at 25,000 would be something that would make you more competitive. Now, there's nothing wrong with actually asking for more money. There's nothing wrong with going over that 50,000. It's just that keep in mind, you're going to have a really solid application and a really solid project idea for us to think about giving that kind of funding out. So keep that in mind. And then we're going to ask you to break down that money you just told us that you're going to need. So we want to know what the salaries and wages are going to be with a brief description, the supplies, the equipment, your travel that you're going to have to do, any subcontracts you're going to give out, and any other categories we may have missed. So we're going to really want you to actually break down your budget. This is a requirement. If you're not 100% sure where something should go, you can ask us. But we do not want you to ask for 50,000 and then all of a sudden we see 50,000 in salaries. We're with no description. We're going to really want you to explain yourself. And then we really want you to tell us what the estimated reach of your program or initiative is. So if you think you're going to be implementing it in 3 counties and you're doing an annual visit program, you can estimate the number of reproductive women of reproductive age in those counties and say that's probably going to be your reach. That's fine. We just kind of want an estimate to give us an idea of like how many counties you're thinking you're actually going to be working in and how many individuals you think you actually are going to be reached or how many you plan to serve. Okay, so some people have a little bit of a difficulty actually connecting their project to our national performance measures or our state performance measures. This is explaining a little bit sort of our areas of focus, and we really want you to choose either one to multiple domains. So it's fine if you have a project that's actually going to hit smoking during pregnancy, safe sleep, or well woman visits. You can pick as many as you want. That's fine. So this just gives you an idea of maybe what area your project could fall into. So for domain NPM1, well woman visits, the percent of women ages 18 through 44 with a preventative medical visit in the past year, that's how we measure that in a long-term outcome. Examples of potential programs or initiatives could be group prenatal or postpartum care classes, just postpartum care in general, parenting support classes, doing something around well woman annual visits, postcard programs, reminders, access to trusted family-centered care. So if any of your projects kind of hit any of these areas, it could be something we could fund. Health communication and education, and anything involving equity, justice, and accessibility could hit well woman visits. So if you want to do a project around transportation, if you want to do a project around educating people on where they can go, all of that could hit well woman visits. Let's talk about safe sleep. We measure this as the percentage of infants placed to sleep on their backs on a separate approved sleep surface with soft objects or loose bedding. So this one is measured off of our PRAMS data. If you don't know what PRAMS is, please feel free to go to our Maternal and Child Health Epidemiology website on the Wyoming Department of Health website, and you can see all of our PRAMS data on there. But PRAMS is a survey that goes out to women who have recently delivered and asks them questions about their knowledge and their experiences during pregnancy. And then examples of potential programs and initiatives could be sudden unexpected infant death prevention. So anything that has to do with food definitely is something we're interested in funding. If you are interested in doing a fetal infant mortality review, that's also something that could fall under safe sleep. Anything that is more upstream, anything you can imagine eventually could hit this outcome, we're interested in funding. A community action team that actually brings people together to focus on this topic, and managing a community action team could be something. Safe sleep initiatives in general, and then partner and family engagement could be something that would fit under this area. And then domain 3, which is our state performance measure, number 1, smoking during pregnancy. Percent of women that smoke during pregnancy, we get this number again from PRAMS. So any project ideas that focus on additional support for tobacco cessation and linking maternal and child health populations to care. Community action team, again, probably could fit under any of these areas. We're very much interested in funding people that want to bring a group together to come up with program ideas from there together as a community. Anything that works on ACEs and social determinants of health, more upstream approaches, data capacity, use, and evaluation. So even bolstering your local ability to figure out your data is also something we could fund. And then program and policy development. So looking at the rules in your community around where you can or can't smoke could also be something that could impact this. Okay, so now we're getting into the nitty gritty. We ask that 1 through 4 don't go over 2 pages in length. We know that this is a little bit hard to guess when you've actually hit 2 pages, but on our FAQ, we actually have a word count on there as well if you want to make sure that you're staying within guidelines. So number 1 is program and initiative description. Please provide an overall description of your program initiative and how it intends to help achieve the goals of your selected NPM or SPM. So all we want to know here is, okay, so you picked safe sleep. How is your project going to actually impact safe sleep? So we previously asked you what your short-term outcomes were. Step us through your program. So you should show your sustainability. You should show who's responsible and who's doing what on what timeline, how it's going to be implemented. We want to know how your project, how you're envisioning your project is going to work, how the short-term outcomes are inside of that project, and then how you're going to get to that long-term outcome, which should be the NPM or SPM. So like impacting your safe sleep numbers, your annual visits, and your tobacco cessation. So previously, I will say, and this is just a little hint, that the applications last year, people would pick annual visits and then they would write in a project that didn't seem like it would actually impact annual visits. It was only very lightly connected to annual visits. So we want you to really explain to us how your project is connected to annual visits and how you're going to be impacting that. Okay, and then need. What need does your program initiative address, and how specifically does it address this need? So in your response, be sure to include how you identified the need in your community, who is involved in that identification process, and the sources of information that support the identified need. So we really want to make sure that if you're telling us you're working on a safe sleep project that focuses on improving breastfeeding, we want to make sure that it's actually a need in your community. So please tell us where you got your information from. We really recommend people use our own website. So we have a lot of data that shows the gaps and the needs in the community on our website. You're more than welcome to use the data from our epidemiology pages to show that there is a need in your community. We will say that if you are from your own community, anecdotal stories are fine because you are your community, but we do ask that on top of giving those examples, saying what you've witnessed yourself in your community, we do ask that you also bring some research to the table. And since our website has that research already, it shouldn't be too difficult to find something that shows the need in your community. And I want your need to match number 1. So if the need in your community that you're focusing on is that women aren't breastfeeding, that's not something that was an NPM. So I want to see your need hitting your NPM, okay? So those should be connecting. And then number 3, the identified benefit. How does your program benefit the key population you identified in your program or initiative description? So we all know that when we're talking about our projects and programs, we can get a little wordy, and sometimes it's not clear to the reader what your vision is on how you're actually going to be benefiting your key population with your project. So just make it really clear. It doesn't have to be very long. What is the clear benefit of your program when we're looking at your key population that you identified as having a need? And then health equity. So we're really interested in what ways your program or initiative addresses health inequities and discriminations in your key population. I will say that we will talk you through this. If you are unsure how your program could be addressing health inequities, feel free to email us. We're happy to talk about it. I will say that Wyoming is a very rural and frontier state, and increasing access to care and improving health for rural and frontier communities is considered something that addresses health inequities. So, we're happy to talk you through what that looks like and what you could write about. But in general, if you are working with a rural population and a frontier population, it should be a little easier to say what the health inequities you're addressing are, because generally that's going to be access, transportation, all of our favorite things in Wyoming that impact our health very greatly. And then if let's say you're working with a specific population like Medicaid, which is systematically generally underserved compared to other insurance groups, that's also something we can help talk you through. But just keep in mind health inequities and how your project focuses on them is definitely something we know people struggle with talking about. It can be hard to envision what that is. We're happy to help, so just email us. So the next steps, so we kind of went through the steps already on the first slide, but this will just be a reminder for you when you're filling out the form, what you can expect. I think the biggest thing to focus on here is how we're going to be scoring you. So all of the applicants are going to be scored the exact same way, describing in your application the feasibility of the program. Is it sustainable? Is there someone responsible for every step? Is there a timeline of implementation? Is going to get you 0 to 10 points. Can the applicant describe the need in your community? 0 to 10 points. Again, I remind you, the need should match your NPM, which should match your project. So they all should be connected. I don't want to see people putting that the need in the community is that people don't have transportation, and then your project doesn't address transportation. They should all be connected. Applicants clearly connect the need, the key population, and show the benefit of the program. That's 0 out of 10. Application is clear and aligned with the selected domains or the national performance or state performance measures, 0 to 10. The budget breakdown is reasonable for the proposed program or initiative. So if you say your proposed program is going to be that you're going to give out educational flyers in your community and it's going to cost $65,000, we're probably going to have questions. So just keep in mind that whatever you're doing in your community should match your budget, 0 to 5. Health equity considerations are described clearly and address inequities and discrimination, 0 to 10 points. For a total of 55 points, that's how we're going to score all the applications. Very clear how we're scoring people. And then the top applications will move on to step 2. Step 2, the applicants in this round of review will be asked to present your program or initiative in a more detailed 15-minute presentation. We think it's really important to talk to people. Sometimes you don't get a clear idea of really what the program is addressing until you've talked to someone who's passionate about that topic. So we want to talk to you. So they'll give a 15-minute presentation with a 15-minute question and answer portion. So a total of 30 minutes. And we will be giving you a PowerPoint template. And then the presentations will be held the week of April 15 to 19. So keep that in mind when you're planning in the future if you think you're going to be moving on to step 2. If you are selected for funding, we will enter into a subrecipient agreement with the Wyoming Department of Health. We will take you through that process, no problems. Again, this is why we really need you to have a UEI number, because if you don't have a UEI number by the time we get to this portion, we may not be able to fund you, because it's going to take you months to get the UEI number. And it also takes us months to contract with you. So we want to start going through the contract period during April, because we want to fund you in October. So to get, I know that's a lot of months in between, and you're thinking, we're definitely not going to take up that much time. I promise you that we will take up that time. So make sure that you have your UEI number ready to go by the time we may award you in April. Okay, and then the goal is to support you and work with you to get the contract signed and up and running October 1st, 2024. Thank you. So again, we are so excited that we get to offer this to our community partners. We love being able to actually fund local community agencies and organizations. Generally, the state tends to fund bigger organizations that are state focused. And not to say that you couldn't apply for that here as well. We just really like the fact that we can offer this opportunity to our smaller community organizations. We try to make the application process as easy as we can, considering that we understand most organizations do not have a grant writer just ready to write grants at any moment in time. So if you have any feedback for us on how we can improve our process, we're more than happy to hear it. We want to make this process easy, but also we want to give you structure so that you can create the best program or initiative that you really can, and we really see the change in your communities and the impact that has. Thank you for your time. We look forward to reading your applications, and we hope to speak with you soon.